The COVID-19 pandemic is putting a mental strain on just about everyone, especially those working on the front lines.
A nurse and emergency room physician at Wilbarger General are giving us an inside look at what it's like to work at a hospital during the pandemic.
From the things they've learned since the pandemic started to the toll it's taking on the people trying to save as many lives as they can. Jaren Spoor has this story.
I have experienced a lot more death up there on the floor than what I've done in my career.
Since the first case of COVID-19 was reported in Texoma, a cloud of uncertainty infected our frontline workers.
Every day is really different. I mean, there's always new challenges coming in the door. You never know from minute to minute what's going to come through the door or what you're going to be presented with.
It's definitely been difficult and challenging. This is a new disease, and none of us knew initially what was going to happen with this.
There's usually an ebb and flow that comes with flu season, but with COVID-19, there's been a tidal wave of patients.
Typically, in the hospital in general, we have lulls. We have times where there's less disease going into flu season, things like that. And instead, we've had consistently full beds here in the hospital for the past 3 or 4 months. We've asked so much of them. We have nurses that haven't had a day off in the past few weeks.
But the hardest part is the sense of helplessness that no matter what they do, the outcome remains the same.
I do everything that I'm trained to do and everything that I've learned about this virus, and a lot of times you know what the outcome's going to be no matter what you do. There's absolutely nothing you can do to change the outcome, even with all the training that we have.
Now, Crumbly says one thing she's doing to help relieve stress is working out.
Well, next week, see how United Regional ER staff members are doing and the resources provided to them to help them get through this very difficult time.